This is Lori Hensley-Wochez, and I'm an Associate Director at HSAG. For those of you that we did not get a chance to meet with over the summer, the intent of the HQIC is to provide customized quality improvement outreach to meet the specific needs of small, rural, and critical access hospitals and those serving higher ratios of vulnerable populations. And just as a side note, and for your information, CMS defines vulnerable populations as the elderly, medically underserved areas, chronically ill and disabled, and low-income and or homeless individuals. The support contract spans 4 years, and because it is funded through CMS, as Dr. Dalton, our CEO, mentioned, and Christine, the participation in the program is at no cost to your organization. We did meet with CMS leadership last week for the official national kickoff of the program, and now we're off and running. The program is a little different from previous CMS quality improvement contracts in that CMS provided us with a list of facilities meeting those eligibility requirements. The HQIC is an initiative that's designed to target resources to areas most in need. And additionally to the small and rural providers and those serving vulnerable populations, there are also providers included who have had performance challenges, such as scoring a CMS 2-star below rating for 4 consecutive years. The goals of the HQIC align with the CMS quality goals of decreasing opioid misuse by implementing a robust opioid stewardship program and decreasing opioid adverse events, including death due to overdose. Goal 2 is increasing overall patient safety by reducing all-cause harms. And for those of you who participated in the previous HIN with us, or I say that, any CMS program for quality improvement, you'll recognize most of the outcomes. Many of them roll into the AHRQ PSI 90 measure that Christine discussed earlier, such as reducing hospital-acquired infections using IP practice, hospital-acquired pressure injury, preventing post-surgical VTE, among others. And airway safety and diagnostic error are the 2 new outcomes in the initiative. You'll notice there's no Goal 3. It's because Goal 3 of the CMS quality goals is chronic disease management, and that is not within the scope of the HQIC. Goal 4 aligns with the national goal to increase quality of care transitions and reducing readmissions, focusing on high utilizers. Now, you might ask how and why we would focus on care transitions in a critical access or rural setting. And there was a study of recent Medicare data that identified that beneficiaries in isolated areas were 19% less likely to have a follow-up healthcare visit within 30 days of an acute care stay. Also, patients that lived in rural areas were at higher risk of ED visits than patients in urban areas, and they have a 42% higher risk of unplanned readmissions than those in urban settings. So this all suggests the need for some additional support for care transitions in rural settings. The HQIC initiative seeks to support improvement in all the outcomes that we've talked about, but with infusing the additional concepts of person and family engagement, and that includes the shared decision making and ensuring the patient is at the center of their care. Reducing disparities by improving health equity. We can only do this by drilling down into our outcomes, looking deep into our data to identify where we might be able to deliver care in a different way to meet specific patient factor needs. When we're talking about healthcare delivery, we're talking about a culture of safety and transparency. building out and ensuring hospitals have a comprehensive quality improvement infrastructure, and that goes from the board of directors all the way to the frontline staff, making sure that your quality initiatives are fully backed and supported by your executive management. And that includes high reliability organizing. And last but not least, in times of public health emergencies, like the one we're in now, the hospitals are ready with their defined emergency readiness plans and are prepared in times of pandemic or in similar emergent situations. And if you're a visual person, here is a really nice graphical representation of the HQIC topical work with the systemic and community topics. Along the left-hand side, there's readmissions and emergency response, and then adverse drug events, including opioid safety and glycemic management and anticoagulation safety, and then infection prevention and all the infection outcomes. And then the nursing-sensitive topics along the right-hand side. And these are all under the larger umbrella of quality and safety culture. And they're supported by, of course, engaging patients and families in understanding and tackling disparities. And you may look at the slide and think, oh my goodness, that's a lot of topics to address. And the way we would like you to see this is if you are working on high reliability concepts or safety across the board, then anything you do in that arena will affect and improve your outcomes at this scale. So keep that in mind. And as an awardee of the HQIC, HSAG is responsible for and we're committed to supporting you, our hospital partners, as well as CMS under the award. We take the work very seriously and we're passionate about improving patient outcomes. We're committed to ensuring our support aligns with your quality and patient safety strategy, and we'll be doing this by engaging and planning with your leadership and quality boards. Because your resources are limited, and we recognize that, we'll be swift and flexible or agile to ensure that we are meeting you where you are in your quality planning journey. And you will receive one-on-one support when needed. We pledge to work with the other state, regional, and national stakeholders to avoid burden and redundancy. And we will be offering multi-pronged strategies specific to rural settings and areas with high proportions of vulnerable populations. Also, it's really important for us to receive feedback about the programming and kind of like putting patients at the center of their care, we want you at the center of your program and support. So it's really important, and we will be asking for your feedback during this contract.